So
2 days in a week I do.
Okay, two days.
2 days in a week, that's all, not every day. I see about 30 to 35 patients. I think that is a very, very big amount for cancer. Dealing with them is a big thing.
Can I ask a medical question to you?
Yes.
Now you have been in this field for almost 70 odd years. 60 to 65 years, right? So there's a lot of change actually in the medical practice, in the literature, in the technologies. So you're the best person, I think, to give a comment on this. What are the changes? Are they for the good? Are they for the bad actually? Or they are mixed sort of things which are rolling out?
This is exactly what I was trying to convey
today in the talk she included.
Students. I started with initially because it was going to be a talk for the students and undergraduates.
Yeah.
So I first talked to them about medical practice, ethics and values, etc. Then I went on to cancer because I find when I see the when people come for interview, I find their understanding of cancer is minimal, not at all aware, including medical graduates. Even after they do their post-graduation, their understanding of cancer is limited. So I thought very briefly, I prepared it only for perceived it as a meeting for younger people, but then now let me tell you one thing. From the time of Hippocrates we have had cancer. Cancer is immemorial, it is there. And work has gone on right from the time of Hippocrates, 2060 BC to date. Research is going on continuously, and lot of things have happened. But at the end of the day, I don't know whether you have read Abraham Mukherjee's book, Cancer as a Emperor of All Maladies. That is how he calls it. Why? Because we still have a long way to go. But we have come a long way. We cannot ignore what has happened, but what is yet to be done is a long thing. Now, we have cancer, as all of you must know, is not a single disease, is a multiple.
Multiple, yeah.
And number two, the heterogeneity of cancer. The heterogeneity, I mean, no two cancers of the same type are alike.
Yes.
That is our greatest challenge.
That is a good.
This heterogeneity, we are trying to understand the heterogeneity by molecular diagnostics and genomic studies. See, but we still, in spite of the fact we have improved our diagnostic capability, we have improved our methods of treatment, targeted therapy, everything. Only one thing continues to be an enigma, continues to be a challenge: prognostication. Prognostication of what? I do not know today. The ideal treatment is given to two patients in the same way, same stage of disease. One patient will react in one way. That prognostication is still a challenge to us. That prognostication, if we find, number two, the important is a metastatic potential. That is also we are not aware. So these are two areas that challenge us, that has to continue. But beyond that, from point of view of improved survival, improved quality of life, improvements in technology, in imaging, in diagnostic capability, in therapeutic capability, radiation therapy, surgery, concepts in surgery, chemotherapy, everything we have done phenomenally well.
True.
People whom we were considered incurable are curable
Are getting
today.
cured, yes.
But we have this challenge. But the greater challenge, according to me, is what we have achieved, we are not able to give to everybody. Everybody who needs it.
Who needs it.
Now the underprivileged continue to be without the treatment. That is the greatest challenge that we in India, we the minimally developed people have to face. I think that is the one. And again, there is a technology has changed the attitude of people, the way they approach now. The minute there is a technology, they feel they have to use it. Availability of a technology should not be the reason for its use.
Okay. Absolutely.
The technology is to be used based on the benefit and benefit to the patient. I keep saying it must be patient-centric and not physician-centric. So these are areas that we have to look into. So there are a lot of things I can't say.
Yeah.
So much has been done, much is yet to be done. Personalized care, targeted therapy, immunotherapy, nano is not yet come, immunotherapy.
Yeah.
All of them are now working wonders. But they are working wonders at a huge cost. Even in the United States, they cannot afford it. They cost hundreds of dollars, immunotherapy. Now today, one targeted therapy for a cure, what we consider curable and improve the cure, is going to cost us 6 lakhs.
Yes.
How many people can afford 6 lakhs?
Hardly few.
Very, very little.
Very few, very
little. And that is the reason why we have 50% of our cancers are preventable and curable.
Yes.
Prevent them and cure them.
Yeah.
Because in the last 60 years, I've seen this cure happening.
Yes.
But there are 50 more where we do not know. Continue the research. Research is vital. So that is how I would think in terms of cancer. Now the other way, cancer, call it emperor of all maladies, whether we can at any time conquer cancer, I have grave doubts. The reason is cancer is another form of life.
Cancer is another form of life. Yeah.
It's no different from us. It is a monoclonal. It arises from one of our own cells. Can you prognosticate life? Can you say when a person is going to die?
No.
No. Similarly, life is going to be, because from all the present day molecular and genetic studies, you find that the cell coming out of our womb, it is antagonistic to us.
It is
That is
antagonistic.
why it wants to destroy us. Before we try to get a targeted therapy, he or she, I always say, is already on the task to see how we can counter us.
Yes.
So it is a war going on inside.
Absolutely.
That is the way I look at it.
Surely,
So
surely.
It's going to be but gene research can give us results, gene profiling. Now, extensively, what is being done is to study the gene profile of all people who are treated with different modalities of treatment, and see whether we are able to get some answer. It will take a long, long time. I don't know whether I have given you any reasonable answer.
No, definitely.
It was a very good, it was very perfect answer. I just wanted to know about the medical practice which is happening now in India, whether it is evolving for the good or we need to change the...
Technology today, again I was saying, technology, both diagnostic and therapeutic, has worked wonders. Our longevity has gone up.
Yeah.
Incurable diseases have become curable.
Yeah.
So many other things have happened. But it has led to two, not very good things. One is the proliferation in specialists. Now everybody wants a specialist. Today they want specialists, super specialists, super. And then in every one of them you have a technology. Now there are multiple technologies everywhere. Now the interaction integration of these people, it enhances the cost of treatment phenomenally.
Yeah.
And people, again, more than 60 to 70% of medical professionals are not patient-centric but physician-centric.
They are physician-centric, yeah.
That is the worst challenge that we have.
Okay.
And if you keep telling people don't like
Yeah,
me.
they don't
Absolutely,
like me.
absolutely, yes.
You are telling the truth.
Yes.
But I always say I'm telling the truth, nothing but the truth. So they have forgotten doctor-patient relationship.
Yes.
They have forgotten the oath of Hippocrates that they have taken. I want the people, medical people, young people, to repeat the oath of Hippocrates every day. Like they say, they go and say Narayana or Shiva or pray. They must repeat the oath of Hippocrates.
Yes.
See, the oath of Hippocrates says, service to humanity, respect for all, malice to none.
Malice to, yes.
They have to do that. Respect for all. Respect for all in the sense you have to respect not only your colleagues but your patient.
Yes.
Respecting the patient is very important. They don't think in terms. So doctor-patient relationship and ethical practice is very badly lacking.
Okay.
That is, so the minute there is a technology, yes, I have to use it. They don't know what it is now, and there is a type of unethical marketing. Apart from
By the
professionals,
instrumental and
it will
yes.
be marketing people.
Absolutely.
And these people, the marketing people and the professional get together.
Yes.
And there is a loss of the patient as a result.
That affects the patient.
This is what is happening. And again, one of the things that we have to see will be how best we can change the ethical practice and mentality of the medical professional, and that has to be done at the student level.
Yeah.
Absolutely,
that
absolutely.
That is what. We don't have these teachings in the course nowadays actually, which
No,
are...
in the medical training, they don't have humanity, communication skill.
They don't have anything.
They don't have.
I think
They must do that.
Nowadays they are trying to get that course. Now in PG courses they have imbibed this communication skills. There is a training for 1 month in the beginning.
Usually the MC